Have you ever noticed that what used to happen effortlessly now requires extra effort, every glance, every thought? What if there's a way to turn back the clock without a single pill? Imagine waking up tomorrow and feeling more confident than you have in years. No prescriptions, just simple changes you can start today. What if I told you that men over 55 can reclaim firmer, longer-lasting erections naturally by tweaking just a few daily habits? Curious? Let's dive in. Hello everyone. Welcome back to Senior Health Essentials, your go-to channel for practical, science-backed tips to help us all live longer, feel stronger, and stay sharp through our golden years. A board-certified urologist who has spent years treating men just like you, men over 55 who notice that achieving an erection doesn't come as easily as it used to. If you've experienced that sudden frustration, when what once happened automatically now demands more effort, you're not alone. Today, I want to explain why aging changes our bodies in ways that affect circulation, blood vessel elasticity, and hormone production, and how you can still regain potency and improve erections naturally. As we age, our cardiovascular system shifts. Blood vessels lose some elasticity, making it harder for blood to flow smoothly into the penis. You might remember a time when a mere exciting thought was enough to trigger a firm response. Now, however, it might take extra stimulation, longer foreplay, stronger desire, or just more patience. That's because blood circulation isn't as efficient as it once was, and the tissues in your pelvic region require robust blood supply to achieve and maintain an erection. At the same time, testosterone production gradually decreases. Testosterone is often called the male vitality hormone, and it plays a crucial role in sexual desire, energy, and muscle mass. As levels decline, you may notice reduced libido and a slower response to stimuli. Even the brain's ability to interpret sexual signals can slow down slightly. In practical terms, you might find yourself needing more time or more motivation to get in the mood. But before you assume the worst, before you schedule that appointment for expensive pills, let's bust a common myth. Medication is not the only solution. Far too many men believe that once they turn 55, their only option is a prescription. In reality, natural strategies and simple daily adjustments can significantly improve erectile quality without relying solely on drugs. Think of it like fine-tuning a classic car rather than replacing the entire engine. By optimizing circulation, tweaking your daily habits, and managing stress, you can restore firmer, longer-lasting erections and enjoy a satisfying, active sex life well into your 60s, 70s, and beyond. So, what are these natural strategies? First, focus on improving blood flow through cardiovascular exercise. Walking, jogging, or cycling for at least 30 minutes a day can make a huge difference. Remember, your penis relies on the same blood vessels that feed your heart and brain. If those vessels are clogged or sluggish, your erection will suffer. Next, strength training, like squats or deadlifts, can boost testosterone production and strengthen pelvic muscles, giving you more control and endurance. Even simple Kegel exercises, contracting and holding your pelvic floor muscles, can improve erection firmness and help with ejaculation control. But it's not just about movement. Diet plays a pivotal role. Foods rich in nitric oxide, such as watermelon, spinach, and arugula, help relax blood vessels and increase circulation. Adding healthy fats from avocado, olive oil, nuts, and salmon supports hormone balance, while antioxidant-rich fruits like berries protect your arteries from damage. On the flip side, excessive intake of fried foods, sugars, and processed snacks can create fatty plaques in your arteries, making it harder for blood to flow where it's needed most. And yes, smoking and excessive alcohol can be silent saboteurs. Smoking damages arteries, while too much alcohol interferes with nerve signals and reduces sensitivity. Stress management is equally critical. Chronic stress releases cortisol and adrenaline, two hormones that constrict blood vessels and hamper erections. If you're constantly worried about performance or weighed down by daily anxieties, you may end up in a vicious cycle where stress undermines your confidence and your body's ability to respond naturally. Techniques like deep breathing, meditation, or even simple walks in nature can help break that cycle. Getting quality sleep is another underappreciated factor. During deep sleep, your body replenishes hormones and nitric oxide levels, setting the stage for better erections the next day. Now, I don't want you to feel overwhelmed. These adjustments aren't about a complete lifestyle overhaul. They're about small, consistent changes. Start by going for a brisk 30-minute walk 3 times a week. Swap sugary snacks for berries. Try a 5-minute breathing exercise before bed. In just a few weeks, you'll begin to notice improved energy levels, better mood, and yes, firmer erections. Before we continue, if you haven't already, please hit that subscribe button and tap the notification bell. We share evidence-based tips on men's health, sexual education, and overall well-being. If this information resonates with you, give us a like and type 1 in the comments to let us know you're ready to take back control. If you have suggestions or questions, type 0. Your feedback helps us tailor future videos to your needs. In the rest of this series, we'll dive deeper into specific exercises, nutritional tips, and stress relief techniques that have helped countless men restore confidence and enjoyment. For now, remember this: getting older doesn't mean giving up on a satisfying sex life. With the right approach, optimizing circulation, nourishing your body, and calming your mind, you can regain the potency that you may have thought was lost forever. Stay with us, and let's embark on this journey toward better health and stronger, longer-lasting erections naturally. Let's take a closer look at what actually happens inside your body as you age and how both physical and mental factors can undermine erection quality. First, consider your circulatory system. When you were younger, blood vessels were like well-oiled highways, delivering nutrient-rich blood exactly where it needed to go. But as the years go by, those vessels gradually lose elasticity. Think of them more like aging garden hoses that don't expand and contract as smoothly. What does that mean for erections? Simply put, less elastic blood vessels equal slower, less efficient blood flow to the penis. Without robust circulation, the corpora cavernosa, the 2 spongy chambers that fill with blood during arousal, can't fill quickly or fully, leading to erections that are weaker, slower to develop, or that fade sooner than you'd like. At the same time, your testosterone levels, often called the male vitality hormone, begin to dip. Imagine your body's sexual drive as a car engine. When testosterone is high, the engine revs easily. When it drops, you have to press a little harder on the gas just to get going. Reduced testosterone production means decreased libido, less spontaneous interest in sex, and potentially slower responsiveness to sexual cues. Even your brain's wiring that interprets sexual stimuli can feel a bit sluggish. You may find that what once might have been an instant mental spark now requires more mental focus or physical stimulation to kick in. Over time, this combination of diminishing hormones and less efficient blood vessels can make erections feel more like a chore than something you look forward to. But age isn't the only villain here. Let's talk about vascular health and nitric oxide, a molecule that plays a starring role in keeping those blood vessels relaxed and ready. Strong, lasting erections depend on rapid filling of the corpora cavernosa via healthy blood flow, and nitric oxide is what signals blood vessels in the penis to dilate. However, men with conditions like high cholesterol, hypertension, or diabetes often have reduced nitric oxide production. Why? Elevated cholesterol can coat arterial walls with fatty plaques, and high blood pressure can damage the very cells that produce nitric oxide. The result? Your arteries don't dilate as effectively, making it harder for blood to surge into the penis. Many of my patients with poorly controlled blood pressure or stubbornly high cholesterol tell me they notice erection strength plummeting. They either take longer to get erect or find the firmness isn't what it used to be. It's a real-world illustration of how vascular health issues translate directly into sexual performance struggles. Now, overlay those physiological challenges with health conditions that further impede blood flow. Take hypertension, for example. When blood pressure remains elevated over time, your arteries endure constant stress, leading to stiffening and narrowing. This means less blood is able to reach critical regions, including your pelvic area, without significant effort. Cholesterol behaves much the same way. Plaque buildup creates blockages that make it physically more difficult for blood to pass through. And diabetes? High blood sugar damages small nerves and blood vessels, often resulting in a two-pronged problem: compromised blood flow and impaired nerve signals that tell the penis to initiate an erection. If you've ever heard someone say, "I feel fine until I try to be intimate," then nothing happens. There's a good chance one or more of these underlying health conditions is at play. But don't forget the mind-body connection. Psychological factors can be just as potent as any physical barrier. Anxiety about performance is a perfect example. Picture this. You're on your mind about having to perform. That pressure floods your system with cortisol and adrenaline, the very hormones that tighten blood vessels rather than relax them. This feedback loop works like this. Anxiety spikes stress hormones, blood vessels constrict blood flow to the penis, decreases erection quality, drops anxiety, intensifies. Suddenly, what should be a pleasurable experience becomes an escalating cycle of worry. If daily life is already loaded with financial concerns, job stress, or relationship worries, that tension can easily spill over into the bedroom, making it all the more difficult to relax and respond naturally. The truth is, your body responds to what your mind feels. Tension, pressure, and fear can literally choke off the blood supply you need. Have you ever noticed that when you're under immense stress, perhaps debating whether or not to bring up a sensitive topic with your partner, you find yourself more reluctant to be intimate? That's your brain telling your body, danger is near, even if that danger is just a hypothetical awkward conversation. So, what's the takeaway? Understanding these intertwined physiological and psychological factors is the first step. Recognizing that diminished vessel elasticity, lower testosterone, and reduced nitric oxide production can be compounded by unmanaged health conditions where performance anxiety helps you see that you don't have to blame just one thing. Instead, it equips you to take targeted action, improve vascular health through exercise and diet, manage chronic conditions with medical guidance, and employ stress reduction techniques to break that anxiety feedback loop. By tackling circulation, hormone support, and mindset simultaneously, you're laying the groundwork for firmer, more reliable erections and a renewed sense of confidence in your sexual health. Let's explore practical, natural strategies you can start today to boost circulation, support hormone health, and ultimately enjoy firmer, longer-lasting erections. Think of these as building blocks. When combined, they create a foundation that doesn't rely solely on medication. Instead, by focusing on exercise, nutrition, stress management, and targeted techniques, you can revitalize your sexual health from the inside out. First, let's talk about physical activity and pelvic floor strength. Imagine your body as a well-oiled machine. The more consistently you move and strengthen it, the better it functions, including your sexual performance. One of the simplest, yet most powerful activities is walking. Just 30 minutes of brisk walking each day can work wonders. Walking elevates your heart rate, prompting more efficient blood flow throughout your body. Over time, this reduces vascular risk factors like clogged arteries and poor circulation that directly impair erectile function. If you've ever noticed that after a few weeks of regular walking you wake up feeling more energized, That's your body responding to improved blood flow and cardiovascular health. As a bonus, walking can also help you manage your weight, lower blood pressure, and even improve mood. But walking alone isn't the whole story. Incorporating strength training, think squats, deadlifts, or leg presses, does more than just build muscle. It also stimulates testosterone production. Testosterone isn't just about libido. It supports overall energy, muscle mass, and confidence. Lower testosterone levels often mean reduced sexual drive and weaker erections. By lifting weights 2 to 3 times a week, you're signaling your body to produce more of this crucial hormone. Plus, strength training targets the pelvic region, strengthening the muscles that help sustain and control erections. For many men, exercises like squats or lunges indirectly engage the pelvic floor, but you can amplify results by adding Kegel exercises, the practice of contracting the muscles you use to stop urine flow, holding for a count of 3 or 4, then releasing. Do these 10 to 15 reps 3 times a day, and you'll notice significant improvements in erection firmness and even better control over ejaculation. Now, let's shift to what you put on your plate, starting with nitric oxide support. You may have heard that certain foods can help relax blood vessels. That's because they contain compounds that boost nitric oxide No production, a molecule essential for vasodilation, the process that allows blood to flow freely into the penile tissue. Foods rich in L-citrulline and nitrates, like watermelon, spinach, and arugula, are fantastic allies. For instance, a daily spinach salad or a mid-afternoon snack of watermelon cubes can gradually improve your body's ability to produce NO, leading to smoother, faster blood flow when you need it. Complement these with healthy fats, think avocado, extra virgin olive oil, nuts, and omega-3 rich fish such as salmon, and you're giving your body raw materials to support testosterone production while reducing inflammation that can compromise vascular health. Don't forget the power of antioxidant-rich fruits, especially berries like strawberries, blackberries, and blueberries. These help protect your arteries from oxidative damage, keeping them supple and responsive. And here's a treat. Cocoa and dark chocolate, in moderation, contain flavonoids that improve circulation and enhance mood by lowering stress hormones. Of course, balance is key. Make sure you avoid excessive fried foods, sugars, and ultra-processed products. These can contribute to arterial plaque buildup and directly inhibit nitric oxide production, working against your efforts. Next up, stress management and quality sleep. 2 pillars often underestimated in men's sexual health. When you're under chronic stress, your body releases cortisol, the stress hormone that, in excess, interferes with both NO production and testosterone synthesis. Picture this. You're worrying about work deadlines or family responsibilities, and that worry translates into tense shoulders, a racing mind, and constricted blood vessels, none of which sets the stage for a confident performance. Anxiety about sexual performance can become a vicious cycle. The more you worry, the higher your cortisol levels climb, the worse your circulation becomes, and the more anxiety builds. Breaking that cycle can be as simple as integrating deep breathing exercises or quick meditation sessions into your daily routine. Even a 10-minute walk in nature, where you deliberately focus on the sensation of your feet on the ground and the rhythm of your breath, can lower cortisol and shift your mind into a calmer, more receptive state. Equally important is getting quality sleep. During deep REM cycles, your body regulates hormone levels, including testosterone, and maintains nitric oxide production. Shoot for 7 to 8 hours of uninterrupted rest. If you struggle with falling asleep, try a pre-bed routine. Dim the lights an hour before, avoid screens, and consider gentle stretches or breathing exercises. Better sleep not only sharpens your mood and energy, but also sets the stage for healthier erections the next morning. Beyond exercise and stress management, There are additional natural techniques you can use to give your circulation a direct boost. For example, penile massage, applying gentle, circular pressure to your genital region, can increase local blood flow and improve tissue oxygenation. Think of it as a mini workout for the tiny blood vessels in the penis. Similarly, warm compresses applied to the pelvic area can promote vasodilation, priming circulation before intimacy. Hydrotherapy, alternating between hot and cold water jets in the shower, acts like a natural vascular exercise, stimulating blood vessels to dilate and contract, strengthening them over time. Even simple sunlight exposure in the morning can help. Safe doses of sun increase vitamin D production, which is essential for healthy testosterone regulation. And don't underestimate pelvic stretches. Specific yoga poses or hip openers can improve flexibility and blood flow to your groin area, making each erection more reachable. The beauty of these strategies is that they stack. A short walk in the morning, a diet rich in nitric oxide boosting foods, a 5-minute breathing exercise midday, and a quick pelvic floor routine before bed, each small step contributes to a more robust foundation. Over weeks and months, these consistent, natural daily adjustments can yield significant improvements in erectile function and overall vitality, often reducing or eliminating the need for medication. So, if you're ready to take control of your sexual health, start by integrating at least 2 or 3 of these strategies today. Whether it's a 30-minute walk, a spinach smoothie, or a few Kegel reps, every small change compounds into big results. Remember, it's not about perfection, it's about progress. Your body will thank you, and you'll rediscover the confidence that comes with knowing you have the power to enhance your performance naturally. Sometimes, despite your best efforts, walking daily, following a heart-healthy diet, practicing Kegel exercises, and managing stress, erection difficulties still linger. If you find that these lifestyle changes aren't enough, it may be time to seek professional help. Persistent erectile issues can be a red flag for more serious health concerns, such as cardiovascular disease, hormonal imbalances, or neurological conditions. In fact, erectile dysfunction is often one of the first warning signs of heart disease because the penile arteries are smaller and may become clogged earlier than coronary arteries. Ignoring these symptoms could mean missing an opportunity to address underlying issues before they become more serious. So how do you know when it's time to consult a specialist? If you consistently struggle to achieve or maintain an erection despite making healthy lifestyle adjustments over several months, that's a clear indicator to book an appointment with a urologist or endocrinologist. They will perform a comprehensive diagnostic workup that typically begins with blood tests. These tests evaluate key markers like testosterone, cholesterol, blood glucose, and thyroid function, all of which influence sexual health. For example, low testosterone might manifest not only as lower libido but also as fatigue, muscle weakness, and even mood changes. Conversely, high cholesterol or elevated blood sugar levels can point toward metabolic or vascular problems that directly impede erection quality. If your test results show low testosterone, your doctor might discuss hormone replacement therapy (HRT). In skilled hands, HRT can safely bring your testosterone back into a healthy range, improving energy, mood, and sexual function. However, it's important to work closely with a specialist and monitor hormone levels regularly to avoid side effects. In addition to hormonal therapies, a common treatment for ED involves PDE5 inhibitors, medications like Cialis tadalafil, Levitra vardenafil, and Viagra sildenafil. These drugs work by inhibiting the enzyme phosphodiesterase type 5, which allows for increased nitric oxide activity and improved blood flow to the penis. While these medications can be highly effective, they require a prescription because they have potential contraindications. For instance, if you're taking nitrate medications for chest pain or have certain heart conditions, these drugs could cause a dangerous drop in blood pressure, Always follow your doctor's guidance and disclose all your current medications to avoid dangerous interactions. Beyond conventional treatments, there are alternative and adjunct therapies that may be worth exploring, depending on your individual needs and medical history. Vascular stimulation devices, such as low-intensity shockwave therapy, can promote neovascularization, essentially growing new blood vessels in the penis to improve circulation. While still emerging in mainstream practice, early research shows promising results for men who haven't responded fully to oral medications. Some men also find value in natural supplements, for instance, L-arginine, an amino acid that serves as a precursor to nitric oxide, or herbal extracts like Panax ginseng and ginkgo biloba. However, it's crucial to remember that supplements are not one size fits all. Always consult your healthcare provider before starting any new regimen, as some supplements can interact with prescription medications or have side effects. It's important to reframe the idea of seeking medical help not as a sign of weakness, but as a proactive step towards reclaiming your sexual health. A visit to a urologist or endocrinologist can uncover treatable conditions and provide evidence-based solutions tailored to your unique situation. Think of this as an investment in your overall well-being. By addressing the root causes, whether they're vascular, hormonal, or neurological, you empower yourself to enjoy a healthy sex life and reduce your risk of more serious health complications down the road. Before we wrap up, let's review the final takeaways. Multiple factors influence erection quality. After age 55, circulation, hormone levels, and mental health all play critical roles. You have significant control over these factors through diet, exercise, stress management, and targeted techniques like Kegels. Small daily adjustments matter. Walking, strength training, balanced nutrition, relaxation exercises, and quality sleep can produce substantial improvements over time. These habits promote healthier blood vessels, improved nitric oxide production, and balanced hormone levels. Medical evaluation when necessary if you continue to face erection difficulties despite consistent lifestyle efforts. Don't hesitate to seek help. A specialist can conduct thorough tests and recommend HRT, PDE5 inhibitors, vascular therapies, or tailored supplementation, all under professional guidance. By combining healthy lifestyle changes with professional evaluation when needed, you create a robust, evidence-based approach to restoring erection quality and boosting overall health. Finally, I want to hear from you. Were you aware of how crucial nitric oxide is for erection quality? Type your answer in the comments below. And if this video helped you, please give it a like. Your support ensures that more men can access these valuable insights. Don't forget to subscribe and turn on notifications so you'll never miss our next tips on health and sexual performance. Explore other videos on our channel for additional strategies and expert advice to help you improve your intimate life safely and effectively. We're committed to bringing you science-backed strategies for better circulation, hormone balance, and confidence in the bedroom. Join our community today, and let's continue this journey toward a healthier, more fulfilling sex life together.